Streamline North is here today at Ready to Go Clinic with Dr. Mike Hart, the founder and medical director of Ready to Go Clinic. So Dr. Hart, tell us a little bit about yourself.
Sure. So I'm originally from St. John's, Newfoundland. I did a nutrition and biochemistry degree there. Then I graduated from Saba School of Medicine and then came to Western in London, Ontario for my residency and did a family medicine residency. So I've been practicing on my own now for about 5 years, and I've been practicing with medical cannabis for about 4 of them.
How did you get into the cannabis industry? Tell us a little bit about your cannabis story.
When I first started seeing patients, a lot of my patients weren't getting adequate relief, particularly for chronic pain, particularly for mental health disorders, also for sleep at night. And I knew that cannabis was a really good alternative and could be a really effective medicine for a lot of those patients. So because of that, I researched cannabis medicine and figured out how I could open up a cannabis clinic and start treating those patients with cannabis instead of the traditional treatments that I was treating them with before.
Who were your mentors along the way when you were getting into the cannabis industry?
It was a little bit tricky at first because there weren't very many people ahead of me that were doing this. I did have a conversation with a physician, Dr. Arnold Soche. I think that was back in 2014. I'm also a member of the Practitioners for Medical Cannabis. Mm-hmm. So basically that's just a group of physicians, clinical psychologists, and other healthcare professionals that feel that cannabis is a really effective medicine. Mm-hmm. And we usually share emails with each other every single day and just educate ourselves that way. So it's really been a lot of self-education and then just collaborating with my colleagues.
What would your advice be to anyone here or wanting to get into the cannabis industry?
So if you're a healthcare professional, I think that you should put it on your agenda to learn about cannabis, because I think cannabis is a wonderful medicine, and I don't think that this is just like a flash in the pan. I think that cannabis is here to stay. Mm-hmm. So if you're someone who's a healthcare professional, you should really be doing as much education as you can about cannabis. If your program doesn't offer education on cannabis, then educate yourself on that. So I think that as long as you can educate yourself, you're going to have an edge over other people because of the lack of education that's in the industry.
And can you tell us a little bit more about Ready to Go?
Ready to Go Clinic, we founded that virtually in 2016, and now we have a brick and mortar location that we opened in 2017.
Nice.
We've been operating now for over a year. We are a full family medicine clinic, so I do do other family medicine outside of cannabis, but it's largely a cannabis focused practice. Mm-hmm. And we really feel that our patients are getting excellent service here. I'm also teamed up with GrowWise Health. So GrowWise Health is basically a bunch of educated cannabis nurses that are very familiar with cannabis and very familiar with seeing patients who are using cannabis, and they can provide them with a follow-up service. So mm-hmm. That really separates our clinic from a lot of other clinics, because all of our patients are followed up. So not only does the patient see me for the cannabis consultation, they also see one of our cannabis educators, and then they can also phone them 9 to 5, Monday to Friday, anytime if they do have any questions about their cannabis prescription.
So it seems like Ready to Go is doing so well. What would you say you see Ready to Go in the next 5 years?
Well, we do have a really good clinic here, like you've seen, and mm-hmm. We are definitely looking to expand in the future. So mm-hmm. I think you'll likely see another Ready to Go clinic pop up somewhere in the GTA in the very near future.
How does Ready to Go differ from other cannabis clinics?
Well, like I said, I think the big part is that the education that we focus and that we provide to our patients, and we're not just a clinic that feels that you just need cannabis to get through mm-hmm. Your medical ailment. Mm-hmm. We feel that you need other treatment modalities, and that's what we try to provide here. So we don't only just provide cannabis education, but we try to educate people on how to exercise, how to eat right. Mm-hmm. I give all my patients a sheet with them with 30 rules. That certainly can be difficult to follow. Mm-hmm. I struggle to follow them myself sometimes, but you know, they're there, and you know, you can always go back to them as a reminder. So, you know, that's one thing that we tell all of our patients, is that cannabis is not going to be the only answer. You are going to have to do a lot of other things on your own. So it's got to be cannabis, and it's got to be lifestyle changes. It's got to be, you know, both. You know, one may work on its own, but a lot of times, you know, put both of those together, a lot of people get really excellent results. And that's the thing that we're really trying to focus here, that it's not just cannabis, it's cannabis plus lifestyle changes. That's what's going to give you the results that you want.
What would you say the corporate culture is in Ready to Go Clinic?
Well, I don't really think of ourselves as, you know, a corporation. I just think of ourselves as, you know, a company that's just trying to help people, and we're just trying to help people through, you know, many different avenues as we can. And we're a company that's learning too, just like everyone else. So, you know, we're not gonna, you know, just have one treatment set in stone for, you know, the next 5 or 10 years. Whatever comes out, we're gonna try to apply it, you know, right away. Whether it's cannabis, whether it's new, you know, some new techniques on physiology that comes out, whether it's some new techniques on psychology that comes out, whatever it is, you know, we want to apply that right away to all of our patients.
So we also know that there are a lot of challenges in the cannabis industry. How would you say, you know, you guys are going through those challenges, and what they are exactly here?
I mean, I think that the biggest challenge in the cannabis industry is that a lot of patients still can't afford their prescription. So, you know, that's something that we try to deal with daily. Right now, you know, a lot of things are out of our hands. So, you know, the one thing that we do try and do is we do try and put patients with producers that will give them a compassionate discount or a compassionate rate. And then sometimes that can help. A lot of people too aren't aware that, you know, even since 2015, the CRA has deemed cannabis to be a medical expense. So because it is a medical expense, you know, you can write it off on your taxes, so that helps out a lot of patients as well. But in addition to that, you know, I try and do what I can, and I try and encourage patients and other people in the industry like yourself to, you know, just reach out to the government, reach out to whoever you can reach out to make sure that, you know, we can get cannabis more affordable for our patients. And I think that, you know, first and foremost, the cannabis medical tax, that should definitely be removed. So, you know, whatever you can do to kind of help, I think, increase the affordability for medical cannabis patients is probably, you know, the best way to kind of direct your energy these days.
You know, I'm really loving how motivated you are and how much heart you've put into Ready to Go. So it was a pleasure speaking with you today, and let our viewers know where they can reach out to you.
Okay, well, thanks so much for having me. I really appreciate it. So you can find me on social media. So I'm at Dr. Mike Hart on Facebook, Twitter, Instagram, LinkedIn. I also have a website, MikeHartMD.com, and I've come out with a new book recently with my co-author Jeremy Cosson, Friendly Fire, Why Vets Are Ditching Pills and Lighting Up to Treat PTSD, and you can find that on Amazon.com and Amazon.ca.